Hello everyone. This is Dr. Vivek Goel, your nephrology faculty at Doc Tutorials, and it gives me immense pleasure to welcome Dr. Avichal Rajpal. Please let us welcome him with a big round of applause. He
Thank you so
has
much, sir.
performed, he has performed wonderfully well, and he has secured a prestigious rank of AML 4
AML
and
6, sir. AML 4.
ML6 and CML4 in the recently conducted INI Super Specialty DM Nephrology entrance exam. So, first of all, a very big congratulations, Avichal.
Thank you so much, sir. Thanks for having me here.
So, Avichal, let us first things first. Can you just give us a brief introduction about yourself? I mean, where are you from? Where have you done your UG, PG from?
So I'm basically from Moradabad. It's a small city in Uttar Pradesh, and I did my MBBS from All India Institute, Raipur, that is AIMS Raipur, in the batch of 2015, which I completed in 2020. So July 2021, I joined my MD in internal medicine at PGI Chandigarh, which recently concluded in the September of 2024. And this was my first legible attempt at the INISS exam. Uh, and yeah, so uh,
That's great. That's great, Avichal. So this goes to show that you have practically cracked each and every important exam in the very first go, and studying from central institutes has been your thing from the very beginning.
it's
So first, tell me, how did you feel when you saw your result and you came to know that these were your ranks?
sir. Actually, I was out of station and traveling at the time, and for 30 odd seconds, my mind went blank. What has happened? I was expecting. I used to consistently score a particular, particular ranks in the mock. So I was expecting a good rank, but was not expecting it this good. So it
That's
was
great.
shocked for some time, pleasantly shocked, surprised. Uh,
No, no, you were surprised, but I totally wasn't, because whatever little I came in contact with you, and when I saw you perform and when I saw you give me the answers, I knew that you were going to be one of the amongst the toppers.
Thank you so much, sir. Thanks a lot. Means a lot.
Tell me about your association with Doc Tutorials. I mean, what were you a subscriber of at Doc Tutorials?
Sir, so I'd not finalized on giving nephrology until it was close to my final year MD exams. So I was interested in three or four of the subjects. I liked many of my postings during my residency at PGI. And finally, during my MD, like exit exams, I realized ki nephro would be the subject I would want to go ahead with. So after my exams were over, that is around July, I took the test series plus question bank combo pack of the doc tutorials. And from there, I started. So I had already prepared a bit of notes during my preparation for the MD final exam, for which I studied the basics of neurology. But then it was with the help of this question bank and test series that I could consolidate all of them. So the question bank is structured that you have. Sorry, I can't help with that. The question bank is structured such that you can cover the most important topics of Fihali, and you don't have to really go to the, like, if you've read the book, it feels like you're reading the book again while you're going through the question bank. So the most important questions are covered in the explanation of those questions, and then the test series helps you assess key which are the most important topics, what areas you are making your mistakes. So I think that streamlined my preparation. So I think material everybody has, then, but it's very important to streamline it and then consolidate it along the way, such that you can focus on the most important points, because the exam focuses on certain important topics and keeps on repeating those rather than asking you to read everything. So I think and I too had limited time, so I think I had to prepare along those lines.
Great, great. So Avichal has given a very, very specific yet very elaborate approach. So what he is stressing on, I would just like to elaborate for the younger aspirants who are watching this interview and who want to emulate whatever Avichal has done. Whatever Avichal has done, he's basically stuck to the textbook, which is the basic, and to consolidate his theoretical knowledge, which one studies from the textbook, he has maintained a constant touch with the question bank and the test series, because problem solving and test giving is very, very important, because that is when you where you develop an exam temperament. And you may have read the theory of a topic, but unless you solve the questions, you will not get the hang of the topic. Am I right, Avichal?
Yes, sir. Yes, sir. Yes, sir.
That
Because
so
the exam is becoming very high scoring, sir. So I think MCQ skill and the question solving skill counts a lot. Because after
true.
reading, we can reach up to a particular point, but then it's the skill which takes you among the higher ranks, I think.
True, very true, very true, very well said, and that's very, very true. So, Avichal, for a viewer, for a MD, DNB medicine resident who's watching you right now, can you just break down the exam pattern of INISS in a few sentences? I mean, how many parts there are, what are the scoring percentages, and what is the positive and the negative marking system? Just can you break down the exam pattern?
Sir, so exam is primarily divided into two stages. Stage one is the computer-based test. So it will test, around 50 to 60% of the paper would be based on your specialty. So, for example, in nephrology, we'll have around 55 to 60 questions from nephrology, usually around 55, and the remaining out of 80 would be from general medicine. So level of questions from general medicine is not too high. Although I think in this exam it was slightly on the more difficult side as compared to previous years maybe. But yeah, it's pretty much from largely based from Harrison only. So I think if we have prepared wherever we have prepared for medicine, I think that suffices for the medicine part. We just keep revising that. And for the nephrology part, I think both Harrison and Fiali should be the go-to sources. And then obviously, sources such as doc tutorials where you have it consolidated helps you a lot. But you have to keep on revising it. So this is the theory part of it. Then for the stage two, so people who have scored 50% or more in the theory exam, that is more than 40 marks, they would qualify for the interview stage. That is the departmental assessment that is conducted by currently, as of now, by AIMS New Delhi. So that is the panel includes all the faculty from AIMS Delhi. And for the last two sessions, I think it has been a non-structured interview pattern. And this time too, it was. And it will be a 10 to 15 minutes interview depending on the candidate. And they'll like to test your practical knowledge, and they'll try to see how, if you have actually worked in the nephrology unit in your hospital in your residency, and if you have been bedside and you have taken bedside decisions or seen bedside basic clinical proceedings happening. That is what they want to see. So that is how they'll try to test both of your components, and then you get a CML and AML based on the individual theory and then the interview and theory combined. And that is how I think sum it up, sir.
So absolutely, absolutely. So Avichal has clearly broken down the pattern of the INI, and he stated the part one and the part two exams, which is the theory and the interview respectively. So Avichal, can you break down your strategy in terms of, I mean, right from the first year of medicine residency onwards, how did you plan to, or did you plan, or did you not? I mean, to prepare for the DM entrance exam, and how did you go about it?
Sir, I had it at the back of the mind since my MD that like probably I'll be doing a post MD course also, but I had not narrowed down on the particular specialty I would go to. And I also had this concept that I have to be a good MD first. And since I entered into PGI, already knew it would be kind of hectic, and that is how it turned out to be. So till third semester, I did not have any time to focus on studies, just reading around whatever patients I was seeing. and only in my fourth semester I think I started giving a thought to reading books. Otherwise, it was just bedside reading around the patients. And I think so fourth, fifth semester onwards, I started reading, and I had developed some interest in nephrology, even rheumatology at that time. And then slowly, just I think by the time I was preparing for MD final exams, I zeroed down. I wanted a branch which was a mix of a bit of intervention, but largely closer to medicine, and kept me quizzing, and kept me solving puzzles around the patients, and largely these two reasons, sir. Uh, and
Great.
I think my thesis was also on nephrology, so that also played a part. I was involved around patients with AKI for almost 1.5 years, following them up and evaluating them. So that played a part. And then, of course, wonderful faculty in both medicine and nephrology at PGI. I think they played a part in shaping me to take this up for further studies. But fine, like for preparation as such, sir, I think only fourth, fifth sem I starting thinking about it, and only post exam I gave it a proper, a dedicated approach to just entrance preparation.
So basically, you said that you during your residency you stressed more upon being a good medicine resident first. So you did not
Yes, sir.
miss your medicine duties and you did not miss your ward duties to study MCQ textbook. So this is the moral of
No,
the story. This is the go-to message, because if you compromise your residency, no matter what super specialist you become, that will always make a dent in your post DM practice also, because what you learn during your residency, it is absolutely unmatchable, and that those residency days will never come back in life. So what Avichal has said is very, very important. And of course you stuck to your mother textbook of medicine, which is Harrison, which is the core, and on top of that he consolidated with Fihali. So when did you start reading the nephrology textbook, that is Fihali, and made notes out of them?
Sir, I'd made the read only the important topics from MD exam point of view, like glomerulonephritis, CKD, AKI, and the basics of this. I started, I think, sir, in December or Jan 24. This is around 4 5 months away from the exam, to be honest. And revising them just 1 month before the exam, the MD final exam. This happened in May 24, April and May 24. Only after the May 24 like MD exam did I start reading the other aspects. And with the help of the app, I used the app to complete the other topics which were earlier deficient in my preparation.
So that's very, very good. I mean, what because he was doing his residency in PGI, and one knows that how hectic it is there. So he actually didn't get much time to go through the theory in the first and second year, which is absolutely fine. And then towards the end of the final year, when he was preparing rigorously for his theory exam, he basically made notes out of the nephrology textbook which are relevant to the theory exam then. And after passing through the theory, then he studied the important topics from Fihali and consolidated it well through the Q bank and through the test series of our doc tutorials, which have been, very, very specifically curated by us. I mean, those questions are handpicked by me, and we make it sure that those are with adequate explanations, and those are very, very relevant to the current pattern. Because making it very, very tough will again make it no point, and making it very easy, I mean, for the just for the neat SS pattern also will not be doing justice to the subject. So we make the questions in such a manner that it is relevant to the current pattern of the exam, and that is why we have such a high yield rate of those questions turning up exactly or more or less the same in the current exam as well.
Yes, sir.
That's good. So, and how did you prepare for the part two of the INI? That is the mock, I mean the interviews. How did you prepare
Sir,
for that?
I think I cannot stress the importance of your contribution, sir, in that preparation of that part more than it is, sir. So, part two, sir, I had you had taken, I think, around 8 to 9 hours of sessions in 2 days, which was remarkable. I think you used to spend 4 hours, 5 hours with us after 9:30 daily, 2 days just before the practicals. So that helped me first to break the ice. I was slightly nervous. I knew the topics, but I was nervous in expressing myself, and just how to really go about saying it. How you told us how the faculty want to listen to our answers, how to structure our answers, and it helped me just break the ice 2 days prior to the interview. So even though we had practiced for a very elaborate interview and it turned out to be a non-structured one, but because everything was well rehearsed, I think it contributed in a large way to me going well ahead with the interview. So my interview actually went very well, and I think it was largely contributed by those two big sessions conducted by you, sir. Other than that, I think I just read these clinical topics once from the guidelines and from Fihali, sir, just 3 4 days prior to the interview, and rest was, I think, everything was consolidated by you. All the topics, very crisp and nice 8 hours of consolidation, sir. So thank you for that.
So most welcome and thank you so much for the kind words. So that's great, Avichal. I think we've covered almost everything. Just before parting, I mean, anything you want to say? I mean, anything you want to say to a potential viewer or a potential INI aspirant? Any message you want to give to a younger colleague of yours by this medium?
Sir, I think you've already, extracted some things out of me, which I wouldn't have said otherwise. So yeah, but so if you are someone who is sure that they want to take a particular DM field, be it nephrology or anything else, so that's really good actually. So you can spend and divide your time in your residency according to that, but don't compromise your MD medicine residency for that. I think because what strengths and deficiencies which we will develop during our MD time, I've realized that they're going to stay with us. So I think we should try to increase our strengths during that time. And if you have not decided, it's completely fine. I think I was one of those people, and you should take your time and decide because it's something which is going to stay with you for your life, and there is sufficient time, and it's pretty much possible with a focused approach and even a limited time to crack this exam. So it's completely within reach, so it's very doable. That's, I think, my main message.
That's great. So, Avichal, before we part, the last question: which college do you think you will be joining?
Sir, so I'll be getting, I think, one out of PGI Chandigarh and AIMS Delhi, sir. I wanted to take one of these two colleges, and luckily I am in that rank bracket to get one of these. But which one out of these two, I'm still confused. So I'll need your guidance on that. I think we can discuss it.
Sure, sure, we'll discuss it.
Yes, sir.
So great, Avichal. All the very best. Stay connected and
Thank you so
keep
much.
keep soaring the flag of nephrology high. Hope to meet you soon
Thank you
in
so much.
person.
Thank you so much. Same here, sir. Thank
Chalo,
you
bye
so much,
bye.
sir. Thank you. Thank you, sir. Bye, sir. Good night. Bye.